Real news for Americans 50 plus. This is Emeritus News Channel.
Thanks, Glenn, and good afternoon, everyone. It's a pleasure to update you this afternoon. Since the emergence of the 2009 H1N1 virus, we've been talking about the laboratory-confirmed cases, hospitalizations, and deaths, potentially giving an incomplete picture of the story of this pandemic. And so today I'll be sharing estimates that we hope will provide a bigger picture of what's been going on in the first 6 months of the pandemic. I'm going to be sharing estimates for the picture through October 17th, and also I'd really stress how critical our vaccine recommendations are in the priority groups that we focused on. I'm going to touch on 3 areas. First, a quick update about the vaccine program. Secondly, highlighting one of the groups that's very hard hit with influenza complications, people with diabetes. And then lastly, I'll expand on the estimates that we have for you today. The picture of the vaccine supply first. Today we have 41.6 million doses of influenza vaccine that are available for the states to order. We believe that will be somewhat less than what the manufacturers had expected to have reached by this point, and it is just very difficult to predict with vaccine production for influenza. 41.6 million is more than we had before, but it's not as much as we had hoped to have by today. Again, it's an imperfect process, both producing vaccine and then projecting how many doses you'll have at any one point. Seasonal flu vaccine continues to be distributed. The update for today is that 94 million doses have been distributed of this seasonal flu vaccine. Last week it was 91 million, so that's continuing to progress. And the manufacturers have told us to expect 114 million doses of seasonal flu vaccine by the end of the year, and we'll see if we make that prediction that they've made for us. The immunization efforts with this supply continue to be focused on the target populations, the priority groups: pregnant women, healthcare workers, children and young adults up through age 24, adults 25 to 64 with chronic health conditions, and parents or other caretakers of newborns and children under 6 months of age. So those groups are really where the states and cities are focusing the vaccination efforts. We do expect and have seen a variety of approaches to getting vaccine into the path of where priority populations are. States and cities are really in the best position to know how to reach their populations. Many are doing school-located clinics, mass community clinics, providing vaccine to healthcare providers, hospitals, clinics, and some to employer-based clinics, a variety of approaches that really do make sense when you have as many groups to cover as we have. As the supply increases, we do think that access and convenience and ease of getting vaccinated will improve. It may take longer in some areas than others, but a reminder that all of the states are receiving an amount of vaccine that's proportionate to their population and trying to serve their populations as best as possible. Next, I want to turn to diabetes and flu. November is American Diabetes Month, and this is a chance for us to remember that diabetes is a common condition and that there's much that people with diabetes can do to improve their health, particularly in light of the H1N1 influenza challenges. People with diabetes have an increased risk of severe illness from any flu. And when people with diabetes get flu, it can be more difficult for them to manage their blood sugar. They can suffer high or low blood sugar. So paying special attention with flu when you have diabetes is important. People with diabetes account for about 12% of all of the hospitalizations we've seen from the H1N1 influenza virus. If we focus in on adults, 19% of those people who've been hospitalized have diabetes. We know that people hospitalized with H1N1 influenza who have diabetes have a good chance of ending up in the intensive care unit. 1 in 4 hospitalized patients with diabetes did require intensive care unit management. So this can be a very severe illness in people with diabetes. But there are several things that people with diabetes and their caretakers can do to improve their health during this difficult flu season. Certainly, we recommend that people with diabetes get vaccinated with the H1N1 influenza vaccine. They should receive the shot, not the nasal spray, and they should receive the vaccine as it becomes available in their communities. It's very important for people with diabetes to be vaccinated. People with diabetes who have fever and cough or other symptoms of respiratory illness like flu really do need to check with their healthcare providers, because we recommend antiviral medicines, Tamiflu or Relenza, for people with diabetes who develop flu. It's not necessary to wait for the test result to come back on the influenza testing. It's just important to get prompt antiviral medicines. The third action step that diabetic patients can take in the face of this flu pandemic is to make sure that they've been vaccinated against pneumococcal infections. Pneumococcal polysaccharide vaccine is recommended for adults who have chronic conditions like diabetes, and many people with diabetes and other chronic conditions have not been vaccinated with this pneumococcal vaccine. We have seen with influenza pneumonia, including pneumococcal pneumonia, following the influenza. So in this American Diabetes Month, we really remind people to take care of themselves with diabetes and get those two vaccines, as well as seeking care promptly to get antiviral medicines should they develop flu symptoms. Diabetes is just one of several chronic medical conditions that it can increase the complications of flu, and that is recommended in the target population for H1N1 vaccine. Next, I want to share with you a little bit of background and the results of our method to estimate the big picture of how much pandemic influenza we have had in the first 6 months of this pandemic. Our estimates, we believe, give us a better estimate of how much disease, hospitalization, and death there is than we would get by just counting the individual laboratory-confirmed cases. These estimates, again, go from April, when this virus emerged, through October 17th, about a month ago, or literally the first 6 months of the pandemic. Our estimates derive from information from our Emerging Infection Program Network. This is a collaboration with 10 states, 62 counties in those 10 states, that collects extensive information on hospitalizations from influenza, including details about laboratory testing and age and so forth. The Emerging Infections Program Network is one key source for our estimates. We also are using data from other surveillance systems, like the aggregate state reporting of laboratory-confirmed hospitalizations and deaths. So it's with those two surveillance systems primarily as a source that we are then extrapolating to the whole United States and to the entire period of this first 6 months. What I'm going to describe isn't a switch or a change from the way that we've been counting cases so far. What we're really trying to do is just give you a bigger picture, and as many of you know, we've been talking about planning to do this for some time, and we're finally ready. We've tried this a few different ways, and really the estimates converge, so we're feeling pretty comfortable that we'll be giving you appropriate estimates today. So for April through October 17th, we estimate that 22 million people have become ill from pandemic influenza. We estimate that 98,000 people have been hospitalized so far through October 17th. And the upper and lower estimates on hospitalizations are from 63,000 to 153,000. We estimate that 3,900 people have died so far in the first 6 months of the pandemic from this virus. And the estimates there are from 2,500 up through 6,100 people having died so far. We've been talking a lot about this pandemic being a younger person's disease, that it's disproportionately affecting children and young adults and relatively sparing the elderly, very different from seasonal flu. So I also want to give you some estimates for cases, hospitalizations, and deaths for different age groups. So in children under 18, we estimate 8 million children have been ill with influenza, 36,000 hospitalized, and 540 children have died from this pandemic influenza. In the first 6 months of the pandemic, for adults 18 to 64 years of age, we estimate 12 million cases, 53,000 hospitalizations, and 2,900 deaths. For people 65 and over, we estimate about 2 million cases, 9,000 hospitalizations, and about 440 deaths. That's a lot of numbers, and again, I remind you that we've posted those numbers on our website so that you can look in more detail. The website also has additional information about the methods that were used to derive these estimates for those who are interested. We will be updating the toll that the pandemic has taken, these estimates, about every 3 to 4 weeks. We don't think we're going to be able to do this every week because it takes some time for the information to be filled in. There's chart reviews involved and other data collection, but we're expecting about every 3 to 4 weeks to be able to update you on the full illness, hospitalizations, and deaths that the virus has had.